I had received some articles this weekend about the state of Oklahoma, and there was a senator there that was going to propose, I believe there, that APRNs are required to pay the supervising physician. You're probably familiar with this. And they were talking about one physician was paid $30,000 a year. And the purpose of the senator's bill was to negate the cost involved that seemed to be a hindrance in the rural areas, that the APRNs didn't feel like it was fair because there was very little supervision. What is your stance on that?
Stance on paying for that supervision?
Yeah, what do you think? Has the Medical Association taken in the House of Delegates, have they taken a vote on that? Or?
No, I believe we have not.
Is that because you don't agree with the expansion of the scope of practice, or you just haven't gotten that far?
I don't think we've gotten that far as what Oklahoma has done with the paying $30,000, but so no, we've not taken that up.
Has the House of Delegates taken a stance from the expansion of the scope of practice? Have they actually voted on it?
Once again, they've opposed it and are...
they voted on it?
I believe they, and Derek would probably, yes, we have.
They voted on it, that they're opposed to it?
Yes.
Well, if they're opposed to that, what is their solution to the primary care docs in the rural areas to be able to deliver services to more people? What is the changing healthcare infrastructure? What is their solution to it if they're opposed to the people that are practicing and learning how to do different things in the state? What's the solution?
Well, I think, we could go on for till 2:30, 3 o'clock if you wanted to on that answer, but it is very difficult. The solution is you pay the folks that are there, the physicians that are there, and hopefully with putting more physicians there and having their supervision with the nurse practitioners would be the solution. Once again, I sit on the physician, or now it's called the Healthcare Workforce Board, and that's what we're doing, and that's what we're shooting for. And matter of fact, I have a meeting here next week in the same, here in Augusta for that. But so I've always said I was once told, if money's the answer, what's the question? It's about money. It's about paying folks to get them to do what they need to do out in the rural areas. It's, once again, when you're dealing with Medicare and Medicaid population, that's why some of these small rural hospitals are closing. They can't make it on just that type of payer mix. And in some of these counties, they don't have any other payer mix. So it's very difficult. I'm down to one exchange product in my county. And it's Blue Cross, and they may not be there next year come first of the year. So it makes it difficult for the patients too as well, because they have very high deductibles. So I work in a practice where I don't take appointments. I'm a walk-in clinic 5 days a week. I'm there until I see the last patient after 6 o'clock. So, I'm doing everything that I can to try to help access to care and take care of the folks. And I'm a lot cheaper than the emergency room, and I'm a lot cheaper than the urgent care. Okay? I don't think ER is the proper place to have their care. I think it's in a primary care office. And it's with a team, and it's a team with folks with all the same, goal and same desire to take care of these patients, which, once again, very, very difficult with their limited resources.